This is day 6 of the Tiny Feet, Big Steps conference, and I'm Dr. Sipalo, your host for the Global Neonatal podcast. Today is the last day of the conference, and we have yet another incredible person with us to get to speak with and just learn more about. Hello there.
Hello.
How are you doing today?
I'm fine. How are you?
Good.
Yeah.
Can you please get your name and your background?
Oh, well, I'm a doctor, Margaret Nakakeeto Kijjambu, and I'm a Ugandan. I am a neonatologist. I'm retired, but not tired. And so I work a lot with the Ministry of Health under Global Health. And I took on this task of implementing newborn care services in the country. So I help the Ministry of Health with that.
Oh, wow. I
Yeah,
love that. Retired, but not tired.
Many researchers, I realized at first I was really involved in research, but there was so much evidence out there, but this evidence was not really in action. So I said, but I can take that evidence, which is being talked about, evidence-based, and then put it in action. And that is really what I do, trying to establish, I call it a responsive and sustainable system for newborn care in the country.
Responsive,
Yeah.
and sustainable.
So it responds to the gaps, and then I have to make sure that when it responds, it is sustained. So that is why, and QI is about that. So if you want to do quality improvement, you have to come up with small, and I believe why I like this conference, tiny feet, big steps. So those tiny feet, those small things we do, the tiny little things we do, they can make a big. I remember last year, I think, the theme of the World Prematurity Day, that small actions, big impact.
Yes.
I liked that theme so much. That washing hands only, you can reduce the infection rates even by 70%. So, and sustaining it is usually the problem. So I really want the quality improvements we have put in place to be, they can say, I always tell people, quality is not talked about. Quality is visible. If you really have a quality improvement program or whatever, people should come, and as soon as they come in, they see it. They see there is a system there for quality. So that is what my job, maybe I can say as an influencer, I've learned some words, as an advocate for newborn, as a champion for newborn, as a mother of newborn, grandmother. I have so many names back home there.
Matriarch.
Yes, matriarch, Beatrice says that. So I feel that we have to help the young generation. I tell people I'm 65, but we are still working with the young people. And the young people, we have to really help them to realize that they can do it. You know, most people, they may have the skills, they may have the passion, they may have everything, but they feel they don't know how to take the first step. So we, as the people who have gone through it, who have reached to that stage of saying that you can change things, we have to help them as they take the small steps. We are behind them saying, take another one, take another one. You can do it. If you have done, take the next one, take the next one. And then sometimes I'm amazed. They take those first ones with care. Then sometimes they run after that and they leave me, and then I say, wow, okay, ready to go. And then you get another one and you take. And then one other thing I've seen that after that, because in this conference, they asked me to talk about the regional. Yes. Because as you saw, most people are talking about my NICU, my NICU. And actually, I started with my NICU. And then I said, but this NICU is in the national, it is this capital city. How many babies really come from here? And yet every time they say the babies are born out there. So if the babies are born out there, who will reach out to them? So that's why we thought that, as you saw, capacity building. But as I said, that you need some kind of power. You need some kind of authority. People to believe that in you. And that's why I work with the Ministry of Health, because it is the topmost. Like today when we are saying that they are the boss. So if you think that you are going to bring your things and you are not following their policies, you are not following their what, you do not communicate with your boss what you are going to do. Really, I've found even local government is worse. because at the top, because they are policy and what, it is easy to make the policy. But I can say local government now are the implementers, the district health officer, the assistant district, and most people even they don't know the hierarchy or the infrastructure or how local government works. So you take the initiative to know what does the local government act say. What are the policies in your ministry? Because WHO can give guidelines and what, but what does your ministry say? What does the country say? So when we sit in these meetings, for me, for one, I really to say, what is the essential drug list like? So if the essential drug list is there, are your drugs there for your newborns? And if they are not there, so you raise your hand, the list you are putting it up, but this is not there. Are the NG tubes the right sizes? They are not there. And then, as I said, sometimes people up in the country, because newborn, I used to use the word that was in limbo. Nobody was talking about babies. Every time you talk about reproductive health, the first person is the mother. But that mother, I always used to say, she wants a baby. We are reproducing, and she wants a live, a healthy, a what baby. But we don't think when we are planning that how do we plan for this mother to get a healthy baby? So in short, I think the message is clear that you have to have the right, and I always say have the right communication at the right time, use the right words and why at that particular time. And then you have to watch the roadmap. What is trending? You know, some people, you can bring something really out of the world, see what is trending, and also you walk with the trend. You walk
Run with the
trend. Run with the trend. Don't bring something and then everybody will say, what is this one talking about? Always be ear on the ground. You know, you may have been thinking, I've been thinking about this thing I said since I was a resident. But I had to wait for the opportune moment. I had to wait for everything. As I said, that whenever you want change and you see you are not in the timing is wrong, the critical event, which I was talking about, something erupts all of a sudden. I remember when I was still the boss of the neonatal unit at the national level. You know, you want the babies wash basins to clean them. They want this, and it's not happening. Then I got an outbreak of tetanus. Oh, I used it. I went to the administration. I said tetanus. The international law says this. NICU is supposed to be closed. What not? And then they said, but you can't close the unit. I said, so they were like dragging. I wrote to all the health facilities around, and I said, don't bring babies here. We have had an outbreak of tetanus. And then I did what? And because it was the national, now the director stood up, said, what do we do? So then I gave my plan. What does the national guidelines say when you get whatever? And so we implemented so many things, and the things appeared like I don't know how. So critical events.
Yeah. Yeah.
Be ready.
Yeah.
Listen, watch out, read, see the news, see what it's saying, what is trending. Yeah, basically, that is the way. And then, and as I said, when the boss, everybody's a boss in there, whatever.
Yes.
So when you go there, now don't go there as if now you are the other boss.
Yes.
Go there and humble yourself and say what you want to say. Appreciate that they are doing something, yeah. But don't come and think that you are going to tell them what to do. Yeah. They've been doing something. I used to, when I was still now junior, and then my director would say, Margaret, why your baby's dying? Why your baby's dying? I said, why shouldn't they die? Then she said, why are you asking that? I said, you tell me that you gave me this, you gave me this, you gave me this, you gave me this, and the babies are dying. I said, yes, I've given you so many lists all the time. So that's why the babies are dying. So, you know, it is like it hits him back, but in a very casual manner, not to say what. He says, okay, what do we do? Then, okay, now we are talking. Okay, so now we are talking, then you list down the things and why, and then we start, and then we say, because you already have a plan, it is already there. So don't go there and then you don't have a plan. So you say, if we do this, then it says, okay, you're going to be in charge. Like I remember we used to have babies dying, no oxygen. Every time midnight, the oxygen goes. because the central oxygen was not enough. They were using cylinders and it is distributing the whole hospital. It's a big hospital. So one time in the morning, there was a baby who almost died. He had a severe asphyxia and had been long in the ward and was a precious baby to this family. I told the director that night and what. So in the morning, the director, I said, I've been telling about this oxygen. So me, I have nothing to do. But I said, I heard there was a plan some years back before I came that they are going to build an oxygen plant sort of here in the world. What happened in that plant?
Which hospital?
It was Mulago, the National Hospital.
Okay.
So he said, okay. So when digging out, the plan was there. I think it was 30 million or something. And then he said, I put you in charge. And then I said, how long? I said, 2 weeks. Then he said, I put you in charge to see that the work goes on. And within 2 weeks, we had the whole thing constructed and we had an oxygen tank. I think even the oxygen was coming from Nairobi, this big, huge tanks. And, the oxygen thing was what? Just critical. I told the parent, critical event. Yes, and the director was called in the night by this parent, the affluent, some government official. It is just that opportunities, as you said.
Action oriented.
Yes.
Acting at the right time.
At the time.
Critical time.
Yes, a critical time, so that you, who is so vulnerable and you get that opportunity. Yeah.
I really appreciated that point from your panel discussion talk today about just the approach to the government. So one of the things I took home was that you have to be very humble.
Yes.
What other things do you think healthcare workers should have in mind when they want to approach the government?
And then, like I was saying, we become humble when you are mature and what. But the young doctors, because of course the other one sees them, will become vulnerable and you become like naive. So you go there like you are seeking help. Well, I am here, maybe a student or I'm an intern. I'm just new. Now I do, it will take care. You will become now a mentor.
Yes.
But if you go there, you see now, you are here, there are no things to use. There's no this, yeah? So you become vulnerable, you become humble, you become naive, as if the whole system. I would want to know, how do I go about this? When I want this, where do I go? Then you say, okay, sit down here. And then you talk to him and then you automatically, you become his mentor, her mentor. Because every time she has a problem, she will come to you. Every time she has a problem, she'll come. Because even me, when I was starting with the neonatal unit, the then director, because I went there, I said, the thing says this and this. How do I go about it? There's renovation. They had put the special care unit. The neonatal care unit was not a priority. So when I went, I said, I see there is renovating the whole hospital. But our unit, nothing is happening. He said, what is what? I said, we have this, we wanted this, I wanted that one. Then he called the contractor. And then he said, I want you to work with her. She has some issues. The contractor was saying, they didn't tell me this. We worked with her. And when he put everything in order, then he calls me, are you satisfied with this? Are you what?
Yes.
People want to help, but you have to really show yourself. But the way you even approach it and be vulnerable.
Like go there to learn.
Yes, go there to learn. What am I supposed to do in this situation? And people don't know, as one of the panelists said, you have to know who is responsible for what. Don't go to the director when you are supposed to go to the administrator, to the HR. Know where those. So people don't care, especially in the medical profession. People don't care to know who is who in the animal kingdom.
Very important to know your boss, know the infrastructure.
Yes, yeah. But people just are that's there, and then they say things have failed. Things don't fail. You have to have the system, the skills, and also another thing I've encountered in my practice. Sometimes why I said that find the characters, find the one, you will find even that up there, themselves are not their enemies or they are working together. And it's not a problem to start solving it or arguing about it. So when you know that the two don't work together, see each them separately and tell them whatever they are concerned with. I always say people remain professional. Just be professional. Don't enter into wars which don't concern you.
The office politics.
Yes. Before you go and you tell this one because you know his why. And for example, when we have big days like our wife, I say, who is in charge of security in the district? The resident district commissioner, the RDC. I go to the RDC, sir, we are here. We are going to have an occasion here. It's a national occasion. We are going to be, we shall need security. He knows you know that he's in charge of security. Then he will deploy his men. You will not put in a penny because that is his job.
Yes.
But if you don't know, then you start saying, now in the budget, we have to put security. We have to have 2 policemen. We have to have this. We have to have this. So for me, I make those occasions very cheap. I go to the cow. I always have to meet the chief administrative officer of that district. This is the person in charge of the budget. And we say we want this, we want that. But what is he saying? How are they perceiving? I went to one of them and said, no, doctor, they shouldn't tell you lies. The DHOs are the ones who give us whatever. And when you go to the DHO, he says, you see the cow. You go to the cow, he says, whatever he gives us. I say, okay. And you are with the DHO there. So will he tell you lies?
No.
From then you will say, the cow said you are the one. Can you now put there this one? Don't you think we need it here? So that's the way I've been operating and then get success. And then another thing I tell people, let the boss take the credit. Not you as come thinking that you are going to be the credit. Let the boss take the credit. If the boss wants to praise you, let him be the one, but not you to go there and you are shining. So for me, that the way I have gone about that is whatever I take the step, whatever I go back and I tell him, now we did this, what? If you get time, please go there and visit the neonatal unit. Please do what? Please help me to tell your girls and what. And some of them even have given me, like there's one DHO. He said, can we make newborn now, when we are sending staff, he called it affirmative action for newborn. That when they are sending the nurses to the hospital, they send them with a letter saying you are going to work in the neonatal unit. Because when they just send them, the priority of the hospital is different. They will just put them anywhere. So I've got nurses and what. And even when I go to the district hospital and we are going to train, we say we have to have special nurses. Can you select them? And we train them and we also give them some administrative work and what. And so there and then, they always know the good nurse, the one who is passionate and what. I say that one will head our unit. And then we take them on and then we train them. And every time we are in the training, we are saying, you see, here you start thinking of how you are going to do it, how you are going to create the system. So from the word go, she's whatever. And all of them, as you saw them in the chat, if you were there, I still have them 5 years. I've never lost any of them. Yeah, because of that. Because they selected them, the administration gave them to us, and what? And if the districts are a bit difficult, I go to the head there and they send them direct. I work with the ADHO. And when they come there, the letter is saying,
Gems of wisdom.
yeah, so
I've just been a sponge, taking everything you've said in.
Yes.
Thank you so much for everything you're sharing. I think before you wrap up, I'd just love to know, as you've been in the neonatal space for such a long time, what are your hopes for newborn health in Africa?
Okay, newborn health in Africa. First of all, I'm happy because even when I was working training, now we have all in Africa countries, they have started those neonatal fellowship programs, which are very good. And now back home, I'm also pressurizing for short courses for nurses and midwife. And that's why I'm bringing them to such meetings. And because what I believe, nurses, that division, they keep on posting, changing them every 6 months, every 1 year. So I said the only solution is for them to get a certificate or a diploma in newborn. Then they will not take you anywhere. So I'm creating that type of whatever, that in Africa, if we want our nurses and what to remain with us as neonatal, need papers. Get papers and they are neonatal nurses. It is saying neonatal this. So when you go to the hospital and you present, they will not work. And another thing which I was going to start before I retired, I wanted a prenatal division in every ward, because most of the hospitals, the universities, I don't know about some South African ones, but most of the universities in Africa, we have only pediatrics.
Yes.
And then neonatal is there embedded. I used to tell people that, for example, when I was a medical student, we rotated in the neonatal unit or neonatology for 2 weeks. Of course, we are students. You can walk there, you see the lecturer is not there, nobody pays attention. So you go away without really knowing anything. And the question is not an exam for neonatology, it's an exam in pediatrics. So neonatology, a few questions, if you fail them, it's not a big deal. Yes. And it's not a responsibility. Then when I came to my postgraduate, that's when I started seeing things. I said, what is the problem? But also postgraduate, you are there for 3 months. So in 6 years, let's say 3 years and 6 years, 5 and 1, you have only like 3 months. If you do internship in pediatrics, you also go there for 2 weeks. Okay? Because you are getting pediatrics, so you are in social pediatrics, you are in the ward, you are everywhere. Yes. So you only go there for maybe 2 months. So it is ridiculous. So how do you expect? So I realized that most of the medical officers, when they graduate after those 6 years internship and what, they fear neonatology. Yes. Because not because they don't want to work there, but they don't know. Because I have an example. I took some medical officers and I put them and I trained them and I did them, and some were managers. And after doing that, they have made changes, and so many of them have even become managers, because now they started thinking, right? They started feeling, they were confident that I know what I'm doing, and they are really. So I believe that if this neonatology, you should start looking at it at the discipline on its own. Yes. In Africa. And I'm glad now there's the African Neonatology Association. There are so many neonatology associations in different countries, and what breaking away from pediatrics. Yes. So we should break. I'm not saying that we are not pediatricians, but if we really want also to really push, we should break away. I always use the term, we never cut the cord. Neonatology is just a small, by the way thing. So let's break away and come and do neonatology.
That's a brilliant way to end this conversation. Thank you so much.
Thank you.
All right.
I hope I've not taken a lot of. So.